Hi, my name is Sally Hayes of Women in Self-Healing, and I have been a massage therapist for over 20 years. I specialize in preconception, pregnancy, and postpartum massage, and I'm also a certified infant massage instructor. So today we're going to do a little infant massage tutorial for you that you can do with your baby at home. So the very first thing that you want to do is set the stage. So I suggest getting some towels or some blankets and putting those down, making sure that the room is nice and warm and then it's cozy. Here on our massage table, we actually have a table warmer underneath that you can't see, so it's nice and warm. And then we're going to lay something down for the baby to lay on. I would suggest getting maybe a nice candle. This is a nice light scent of French vanilla or French lavender. So it's very simple and very clean. You don't want anything that smells too chemically or too potent. For this, babies have a very light sense of smell. You want to just keep everything nice and light. So you also want a baby massage oil. You can use any of the ones that are on the market or the lotion that you use. And then this one is actually one that I blended myself. It's organic grapeseed oil, and then it just has 1 to 2 drops of lavender essential oil. So just keep it nice and light. If you're going to use anything scented, just make sure it has a nice light scent. And if you're going to use essential oils, you just need the tiniest amount. Now we're going to set the stage. Like I said, it was nice and warm here. So you want to keep a nice warm area. And then you can also do the infant massage right after bath when the baby's skin is nice and wet. We're going to apply a lotion or an oil afterwards, and you can use a changing table, or if you have a changing pad, you maybe want to have this underneath because we are going to stimulate digestion. So there could be some elimination that happens on the table. Just be prepared for that. And you want to make sure that the baby has not eaten for about 30 minutes. Because if you're going to stimulate digestion, they could maybe spit up if it's been under 30 minutes. All right, so baby is nice and cozy. We're using this really great baby today with this onesie that's going to show us the shape of the intestines and also give you a little tutorial of how to do the abdominal massage portion. So I love these onesies. I think they're super cute. Not all babies love massage. You want to start slow. So the first day, maybe start for 5 minutes and then you'll build up day after day. It's a really great idea to do it at the same time every day. After bath time, before bedtime is a really great time. You can also do it before nap time as well. So we're going to start with the extremities. So you're always going to start with the limbs. And with the feet, you always want to make sure that the feet and the legs are nice and supported. And you're going to take a nice flat hand and just massage all the way up. I like to do about 3 strokes of each. You could do 3 to 6 strokes of each just to warm up and make sure baby's happy with this. And go to the other leg, warm this up. Another great move on the legs is to kind of take this ringing motion. So you're going to make a little circle with your hands, hold on to the feet, and then you're going to ring all the way up. And you're going to want to use a medium pressure. So you don't want a super light tickly pressure. You want to have a little bit of pressure there, but not too hard of a pressure. You never want to put too much pressure on any of the joints. So you're just going to kind of lighten up as you go over the knee joint. And where this nice meaty tissue is where you're going to do a little bit of that medium pressure. So that's really nice. And there have been some studies that have shown that a nice medium pressure massage for preterm infants has proven to promote healthy weight gain, which is ideal. So we're going to go up all the way, come all the way back down, and then we're going to go back over it with that nice flat stroke again. So you can do that side, you can come back and do the other side as well. Doing the ringing motion up, coming back down. And then going over with a nice flat hand. Now, some babies have very ticklish feet. You definitely don't want to work on the feet if they've had any shots within the last week. You want to just make sure that's nice and healed up. It's a really great idea. Your thumb is probably going to be a good size for the bottom of this foot. So you can start at the heel and just move straight up. About 3 times, maybe 6 times. And then take small circles starting at the heel with your thumb and just moving all the way up. You can also, between your thumb and your pointer finger, just kind of go back and forth, stimulating the tops of the toes. And again, if baby finds this too ticklish or uncomfortable, just stop at any time. You never want to force massage on the baby, on anyone really. And going back up with a few more strokes. A really great stroke anywhere in this middle section will stimulate digestion. So you want to come from the inside and just do straight lines all the way across. Going back up, coming back down. And then it's really nice to finish with just a little pressure from the thumb in the center of the foot and resting that back down. And then you can do the same thing on the other foot. So another great move is to do passive limb movements. So you can take, you kind of want your fingers underneath this knee right here. That'll help the knee bend, holding on to the front of the leg with your thumb there. And you're gonna bend and just passively move, bicycling the legs back and forth, giving a little movement. And you can also do both at once. And then you can also pull both legs in here and just rotate the hips around. So holding the legs like this and then rotating around in circles for the hips. Both ways. And then you can always just shake it out a little bit. So now we're going to come up to the belly. So we just want to start with these motions of a nice flat hand from the midline out to the side and coming around to the bottom. You can come around and like cup the bottom. You can also do a little shimmy, shimmy, shake there. Coming out, shaking a little bit here. Doing as many of those as you want. Doing infant massage is also a really great bonding tool for the non-birthing parent. It's great for the birthing parent as well, obviously, but this is a really great for any caretakers or non-birthing family members who want to bond a little bit more with the baby.